whereas bulimics certainly don't want to, but they don't have what would be listed as almost a phobic type quality. And in my experience with working with them, is that it can even take almost what we would call a delusional quality. When they would look in the mirror, they look kind of psychotic because they will look at me. I mean, I will have people that are, it's beyond seeing the ribs. You can see the ribs through their shirt, not just like and they will look in that mirror and they'll say, gosh, look at that belly. I can't take it, take the mirror away. And we will have them do exercises where we would have them like take a rope, take a piece of string and have them pull out about how much that they think it would take for them to wrap it around their leg. And they will take like the size it would go around a horse. It would be an enormous amount. And they are shocked when I make them do it on their body that it loops and loops around. Their perception reaches almost what we'd kind of consider a psychotic type of level, and that it's really not listed among a psychotic disorder. So it also takes on the quality of obsessive compulsive traits. A lot of their routines that involve food for anorexic sound very obsessive compulsive. They have very specific, rigid routines where they are, in their mind, they're required to chew so many times on one side, then chew so many on the other side, and then they're allowed to swallow, or they will spend, the anorexics will be spending all day obsessing about what they're not going to eat. The bulimics, for the most part, will be spending all day deciding what they're going to binge on. That's kind of a distinction to sort of remember. But in either case, and as well as with the binge eating disorder as well, but they spend all day about what they're going to binge on and how they're going to do it. And they all avoid activities that involve food, if at all possible. But they all have qualities that are very specific for us to look for in mental health, and that is that they almost never want to come in to mental health. That's, you can just about guarantee, specifically with the anorexia, it's the worst. Bulimics frequently are aware that they have a problem, but they don't want to come in. And I have to say that whenever I treat a lot of adolescents, I'm afraid, which is why I am developing such an expertise in this area. It started with my year of work at Virginia Tech, where I did research for them for a while, and it's rampant on campuses. I could guarantee, just as an aside, a diagnosis of an eating disordered client if they came in with a group of girls. They never came in by themselves. It was like the whole sorority was coming in, forcing somebody to come in. It was never like a solitary kind of thing. They always had a handful of girls would be coming in, confronting. And when I ask, as a standard part of our intake for any client, when I ask them any history or concerns about eating disorders, or what I would call disordered eating, which I'm going to get to here in a second, it's very disturbing what most of the adolescents tell me who don't have a problem. They don't say, well, no, goodness, that's awful, or I couldn't do that, or vomiting is gross, or they'll say, no, I'm not strong enough to do it. They don't say that's a bad thing. They say, I don't have the willpower to do that. So it's even kind of glorified, which is a real concerning thing. And I almost never do groups with anorexics because there's a huge competitive factor. Most anorexics and quite a few bulimics, their individuals are very perfectionistic. They work very hard to meet other people's needs. They're really good at taking care of other people. They're often really good about cooking, but not eating what they cook, and they always talk about how they nibble as they go through, but if you watch them, they don't nibble. But that's what people say. But they have high competitive drives. They're often valedictorians in school, athletes, especially before it gets to the point where it requires such intense treatment. They're often very good students, and they often go into very highly driven and performance-driven careers. And I will get into here in a little bit about some factors that might be contributing to the causes to it. But one of the things that I probably end up diagnosing the most is eating disorder NOS, meaning not otherwise specified, because they are probably anorexics that haven't met that 85% weight issue. They are well on their way. They are doing incredibly dangerous behaviors, and what I talk about is disordered eating. But they haven't lost so much weight that they've reached the dangerous level yet. But that one criteria stops it from truly being anorexia, but it is, in my opinion. Treatment doesn't change, except that I probably don't have to hospitalize them. Let's see, what else do you guys want? Any questions so far? Like I said, I keep rambling. Okay.
I have one question. If it's not, maybe you're going to discuss it later, but the binge eating and the binge eating disorder and bulimia. So the main difference then is that they both binge, but the one group usually almost always does the purging where they vomit, force themselves to vomit,
Yeah.
or?
In order for it to be binge eating disorder, there is no what we call compensatory behaviors.
Yeah, okay.
They don't engage in any excessive exercises. And by excessive exercise, I mean 2 to 3 hours a day is not unusual. Them running 5, 10, 15 miles a day is not unusual. But in binge eating disorder, there's no compensatory behavior. There's no vomiting, no diuretics, no laxatives, no excessive dieting.
So is their body image then different? Because the bulimics then, obviously they do the purging because they feel like they're getting fat from all the stuff that they ate, right? Whereas the binge eating disorder people, they're not doing any kind of behavior are they not as worried about getting heavy, or are they still worried, they just don't have the...
Actually, they tend to be much more depressed and much
Okay.
more isolating. Most of their behaviors involve eating completely isolated. They will be the type of people that would go through like the drive-through, order a lot, and they might even talk about their ordering for the family, and then they'll go in some parking lot and eat it.
So are they heavy people then?
Almost always. Almost always. Especially if you think about the criteria, it has to last 2 times a week for 6 months, that they're eating very abnormal amounts of food and they don't vomit it up, they don't get rid of it. And if you're doing that for 6 months, you're going to gain a lot of weight. But most of these people that I have treated have been coming in relative to getting the bariatric surgery, and I think my heaviest was 792 pounds. Now granted, he was 6 foot something. 6'5" or more. But it was very, very large.
Yeah.
And when you're doing treatment consideration, you also have to be prepared for having the type of facility where these individuals can come in, where they would have chairs that they can sit in, and a facility that can maintain them. And there is, the medical community is making a shift in that direction to accommodate these people. But insurance companies have finally kind of grasped the concept that if we can get these people healthy enough psychologically, that they can then qualify for the medical treatment, their risk of having medical problems goes down astronomically. But they really do have to pass a psychological evaluation, or they will harm themselves post-surgery. And we have to, of course, one of the reasons that they're coming is we have to rule out that they don't have anorexia or bulimia, which anorexia is kind of a given, they don't have that one, but bulimia, because they really will, if they have, or a binge eating disorder, they will rupture their stomach, their esophagus, and have horrific problems. And there are some people that can kind of fool some of the psychological test and can make it through, and then they come into us post-treatment, post-surgery for treatment for it. But I treat both ends of the spectrum, and it's certainly not all of my clientele, but it has been very difficult, and I'm working with my staff to make sure that they are aware of this, that I cannot have my anorexic clients waiting in the waiting area as some of my clients that are coming in for the surgery evaluation, walking through, because they are just simply terrified of weight gain, and when they see someone like that, they see a mirror image in themselves, or what they could be if they do what I ask them to do by making it up to 500 calories, for the next day. It is not unusual for me to be working with anorexics that are having 20-calorie days for several days in a row. They are aware. They honestly can tell me how many calories is in the stick of gum and which brands of gum. And that's their caloric intake for the day. And what is often very disturbing to me is treatment involves working sort of with a team approach. I try to send them to a dietitian, which frequently they don't want to go to. I always send them and make it a requirement for them to work with their family practitioner to do all sorts of blood tests to make sure that there are things that are okay with their heart and their blood panels that are beyond the scope of my practice. But what's very disturbing to me is when things come back pretty normal, and I'm looking at this person in front of me who is clearly anorexic. They meet that criteria of only being at 85% of their weight or less. And they, at the very least, should be severely dehydrated. But our body is pretty fascinating. It takes care of us, and it adapts after a certain amount of time. And I'm always really disappointed because I want to be able to use it as ammunition to scare the person about how much trouble they're in. And then it fails because their body's adapted. They did a study, and I'm going to butcher it up, so I apologize for people who want to go and look it up online, but it was done in Minnesota, and I won't even call it like the Minnesota study that is referred to in a lot of the eating disorder literature.